were returning from Delhi to Chennai. And thereafter, thanks to Shobha, we met again. And Shobha and Dr. Soumya were planning a program. And very happy to meet you now, ma'am. Welcome. It's an honor to welcome you. I will hand you over to our secretary, Wing Commander Harshavardhan, who will introduce you. Thank you, ma'am.
Thank you.
Good morning, ladies and gentlemen. Once again, welcome to our usual Sunday morning eConnect talk show. And like Varta said, we have a very, very great personality, Dr. Soumya, amongst us today to speak to us. Very hearty welcome to you, ma'am, and welcome to this show. And ladies and gentlemen, before I hand over the proceedings to Dr. Soumya, I would like to give a small introduction about her. I mean, not that she requires any introduction, but still, I would like to say a few words about her. Dr. Soumya Swaminathan was appointed as the first chief scientist in World Health Organization in March 2019. She is the daughter of Indian father of Green Revolution, M.S. Swaminathan, and Indian educationalist, Meena Swaminathan. Dr. Soumya holds an MBBS degree from the Armed Forces Medical College, Pune, and MD from the All India Institute of Medical Science, New Delhi. She subsequently held a postdoctoral medical fellowship in pediatric pulmonology from the Keck School of Medicine at the University of Southern California from 1987 to 1989. She's a pediatrician and is a globally recognized researcher on tuberculosis and HIV. She has over 30 years of experience in clinical care and research and has worked throughout her career to translate research into impactful programs. Dr. Soumya was Secretary to the Government of India for Health Research and Director General of the Indian Council of Medical Research from 2015 to 2017. In that position, she focused on bringing science and evidence into health policy making, building research capacity in Indian medical schools, and forging South-South partnership in health sciences. From 2009 to 2011, she also served as the coordinator for the UNICEF, UNDP, World Bank, WHO Special Program for Research and Training in Tropical Diseases in Geneva. She has published more than 350 peer-reviewed publications and book chapters. She is an elected foreign fellow of the US National Academy of Medicine and a fellow of all 3 science academies in India. The role of the Science Division of World Health Organization is to ensure that this organization stays ahead of the curve and leverages advances in science and technology for public health and clinical care, as well as ensuring that the norms, standards, and guidelines produced by the World Health Organization are scientifically excellent, relevant, and timely. Dr. Soumya's vision is to ensure that the World Health Organization is at the cutting edge of science and is able to translate new knowledge into meaningful impact on population health worldwide. Well, ladies and gentlemen, that was a small introduction about Dr. Soumya. Well, ma'am, now it's over to yourself. After you finish with your talk, we will have a question and answer session. And well, that's it. And it's over to you, ladies and gentlemen. Kindly mute yourself.
Thank you so much, Commander Harshvardhan, and thank you very much, Marshal Vartaman, for both of you for your very kind words and introduction. It's indeed a pleasure for me to be with all of you this morning. And in fact, I'm not sure that I deserve, this opportunity and also all the nice things that you said. I feel that I've had a fairly ordinary career. In fact, when I have to think back to say, what were the journey of my life, it appears to me that a lot of the things happened by serendipity. So I will try to go through that journey a little bit. Maybe even for me, it's more like a self-reflection. But I'm sure that many of you have had perhaps more exciting journeys through your own careers in the armed forces. And we'll have many, many more stories, I'm sure, to recount. So, however, since you invited me to spend some time with you, I would endeavor to have more of a conversation rather than a one-sided. So I will start off with some a bit of the journey, as I said, but then let's open it up and maybe have more of a discussion and conversation about issues that may be of common interest. So I grew up in Delhi on the campus of the Indian Agricultural Research Institute, and I was surrounded by students and researchers. And so I think my love for science and research started probably quite early without my even realizing it, because I would spend a lot of time in the laboratories, in the fields, the experimental fields, in the departments, and there were always students coming to the house to discuss their thesis with my father. And many of them, used to spend time with us also, as we were young children at that time. My mother was also doing interesting things at that time with early childhood education, and she was set up what was called the Nehru Experimental Center in the Pusa Institute for preschool education. She was one of the earliest people to recognize the importance of preschool education and nutrition, and set up this center to basically cater to the children of staff of the institute who were working and who needed a place to leave their young children. And it was open to staff of all categories. It was not only for the officers or something like that. It was really open to everybody who needed to put their child there. And it's still running. It's still running after, I don't know how many years it is now, maybe close to 60 years since it was set up. And it has evolved over a period of time, but essentially focused on preschool children. And I also remember in my childhood going with her to the creches that were set up for the children of construction labor. It was an organization called Mobile Creches, which was set up in the early 70s by Meera Mahadevan. And it's still, again, another organization. I think they just completed 50 years and they're still running these creches, and it's expanded beyond Delhi now. So we have children to be with her to visit some of these centers where these young babies and children were being taken care of. We also traveled a lot within India, of course. In those days, one did not travel abroad, but within India, we went to many different parts of the country, accompanied, of course, by my parents. And we also spent summer holidays in my hometown, which is Kumbakonam in Tamil Nadu, where the lifestyle was very different. And it was a very large joint family household where all the grandchildren would come for the summer holidays. It was fairly traditional and conservative household. And we learned to adapt to that environment during the summer holidays, and then went back to a much more, of course, cosmopolitan and liberal environment in Delhi, where we lived. So I think the reason that I say that is because I think it helped to shape me in a way that I was not only aware of, but accepting of different cultures, different ways of life, different belief systems, had exposure to both rural and urban India. And in fact, some of our best friends that we played with were the children of our gardener who also lived on the same campus with us, and they remain very close to us till this date. I should also say that I had very little awareness about caste. We knew about religion because we would meet people from different faiths and religions in the institute that we lived in, and we would celebrate all festivals. We would celebrate Christmas, particularly since there were foreign students living in the institute that did not have a home to go to. My mother made it a point to invite them over for Christmas and and help them celebrate Christmas. There was always Christmas cake that was made, carols that were sung. So we looked forward to celebrating Christmas always because it was a very joyful occasion. But then we also celebrated all other festivals at home, including the Shera, by keeping, the Golu, the dolls festival as it is called. So religion, one knew that there were different religions and people had different faiths and you celebrated in different ways. But I had never heard of caste ever being mentioned. And so it was only much later in my adult life that I was even aware of what caste was. So I'm just saying because I think childhood perhaps at that time was an innocent, much more innocent period. And even when we joined college, we didn't have reservations by caste. So I guess there was no need to be aware of it. I wanted to be a scientist. I wanted to be a researcher. And I wanted to focus on genetics. That was my interest. And so when I finished school and joined Hindu College, Delhi University, that was my goal. My goal was I joined BSc Zoology, and the idea was to complete that, go on to a master's, PhD, etc. Basically to be a basic scientist. Somewhere during that year, I decided to apply for medical school. But possibly it was a bit of peer pressure because all of my classmates, without fail, were in the zoology first year because they were doing it as a pre-medical. This was the days when we finished school at class 11, and then you did a year of pre-med before you took the medical entrance exam. So that was how I sort of was aware that everybody was taking the medical entrance exam. And then during that year, I met some people, including a couple of students who were in AFMC, and got to know that it was a very good college, that it was a very well-rounded education that you got, and you had a lot of focus on extracurricular activities and all of that. And so I came to the conclusion during that year that I would apply for AFMC and take the entrance exam, and that would be the only medical college I applied for. It was appealing to me for some, and it also felt to me that it was some kind of a test of my own destiny, in the sense that I was not so keen on medicine anyway. So I felt that if I tried one and I'd gotten, it was a signal or a sign of some sort. But if I didn't get in, then it would be a sign to me to carry on with my pursuit of pure sciences and genetics. So it was also, people said you could still do genetics after you do medicine, because then you're more focusing on human genetics and so on, and you can still do research. So that's how I took the entrance exam, cleared that, went through the interview, went through the physical test and the physical exam. As you know, AFMC used to take 120 students in every batch. Only 20 were girls and 100 were boys. So it was clearly preference for boys, but for obvious reasons, for serving later in the armed forces and so on. So it was a tough one to get into. Hundreds of thousands of children who would take the entrance exam. So it was a sort of not really a given that one would get in. But anyhow, I did make it into the list. And I had a short service commission, joined AFMC in 1976. And I must say that it was a wonderful experience being in that college. And everything that I'd heard about it was true. I always felt everyone wanted to get into either All India Institute or JIPMER or CMC Vellore. These were the highest ranked colleges. But for me, it was more important to also enjoy, life, be exposed to other things. And that's exactly what happened. There was a big focus, of course, on sports. That teaches you a lot. Teamwork. I was never a sports, enjoyed watching and so on, but I was never a very good sportsman. But I did start playing basketball and throw ball and swimming and running. And Pune in those days was beautiful. It was green, it was open, it was the weather was, excellent. It was a very, very nice city. It still is, I'm sure, but I know it's changed a lot. Every time I go back to Pune, I try to imagine what it was like in the 70s. But the cantonment area is still very nice. I did go back to AFMC many times in the last few years. In fact, the last time I was there, Madhuri Kanitkar, who was 2 years junior to me, was the dean. And she had this habit of going around on cycles. So she and I jumped onto 2 cycles, and 2 of the 7th semester students took us around. And it's very nice that they now have a group of students there who are interested in the history of AFMC. So we actually went on cycles around AFMC with these students, actually giving stories about the different landmarks. And again, things have changed. I mean, it's been modernized, new buildings have come up, and there are now internet facilities, and you can have online classes and teaching, and many things have changed. But it was wonderful to go with the dean, Madhuri, and with 2 students on cycles, as we used to do as students. We used to, basically all of us had bicycles. So we either walked or we took the cycle, because the cantonment area is a big area and one had to go to clinics in different parts of the hospital campus, the command hospital, which stretched all the way up the hill to the cardiothoracic center, which was right on top. And we had excellent teaching, because of the discipline of the forces. Of course, you don't have time off. We used to hear about other medical colleges where there were strikes. There were no classes happening. I had friends and classmates in different medical colleges. And so I always felt I was so lucky to be in AFMC, because you had excellent facilities, excellent teaching. Of course, the brightest of students as well. And we had such wonderful teachers, many of whom, one can never forget, because of their skills and their passion with which they taught their subject. I mean, one of them is General CSV Subramaniam, who was also the father of a very close friend of mine, whose house I spent many, many weeks and months in, literally as a 4th daughter of his. I was almost like the 4th one. And pathologist, beyond compare, very knowledgeable, also very witty and well-read, and would always teach with humor. And a man that, you really had to admire for his, many people actually in the armed forces, with so many accomplishments, but so humble and willing to give of their time and their learning and their knowledge to the students. That's what they got pleasure out of. They didn't get any other recognition. And we always felt very bad when they were transferred out. We had good teachers. Of course, in the armed forces, you get transferred every few years. We also had very dashing young captains teaching us. And so there was always, those classes were very popular indeed. Nobody wanted to bunk those classes, because the idea of having these dashing captains, as teenagers, you romanticize also the armed forces a lot and the lives of people in the forces. So we had those, particularly in our clinical years, we had a lot of people at that stage of their career teaching us, but we also had very senior people teaching us. Professor Mysurkar is one of those luminaries of anatomy. People do not like to take anatomy as a subject. Most doctors would like to go to some other clinical subject. But here was a man who was so dedicated to anatomy, and he was such a good teacher. And he passed away recently in Bangalore. He was in his 90s. And even when I became the Secretary of Health Research and the DG ICMR, he sent me a beautiful 1-page handwritten letter telling me how proud he was of me as his student, and how he remembered all his students, but he remembered some of them very well. And, he said nice things. So it was wonderful to hear from from Professor Mysorkar and people like that, Dr. Zargar. We had really excellent teachers in every subject, from starting with anatomy, which is when you get introduced, to medicine, the dissection halls, the friendships we made. We used to, the dissection hall is not a very pretty place, of course. For most people, would not like to be in there. The first thing is overpowering smell of formalin. And then we used to have cadavers that we had to learn anatomy on. So there were 6 of us to a table. And these 6 people who basically stayed with one cadaver for 18 months that we did anatomy. You went organ by organ. We got very, very fond of our cadaver. We all had names for our cadavers. And there was a personal relationship. And we were, of course, told and taught that we had to respect these cadavers, because, these are people whose body is being used for teaching and for research. And it's a very noble thing to do, to give up your body like that for the family to do. So we had to respect the cadavers. We had names for them. We spent, as I said, 1.5 years. And of course, then we became also very friendly with the 6 people on our table. We got to know each other very well. And there was always this teasing going on, the boys and girls. And there were a lot of things happening in that anatomy hall that now it looks very foolish. But that is all part of growing up and making friendships and being in college. We had a dramatics club, we had a debating club, we had many, many sports. We would go on treks and hikes. And yes, the girls, did have less freedom than the boys, because we had a hostel which had timings and we had to be there, etc. But we still had, I think, a fair amount of freedom to go and explore the surroundings. And again, in those days, Pune surroundings were beautiful. We used to cycle to Khadakwasla, we would cycle to Karki, we would cycle to Lonavala. In fact, I have cycled to Lonavala and back without really thinking twice about it. Now I wouldn't dare to do that, but it was possible at that time. And I still remember that you could go to Main Street and have a really good meal for 17 rupees, a big plate at a restaurant called the Sizzler. And 17 rupees was a lot. We didn't have that always, but we would save up and we would try to go out for dinner once a month, at least, either to a Chinese restaurant or to the Sizzler. So those friendships are lifelong and lasting. And in fact, I'm in touch with all of my classmates now, of course, thanks to WhatsApp and various social media channels. Those bonds that were formed of 5 years of living together in the hostel and going through, essentially your formative stages of life. Of course, girls had a privileged time, I would say, in AFMC because of the ratio of boys to girls. We always had a lot of attention, both from our teachers and from our students, co-students. We got away with a lot. And so everyone was extremely talented, very, very, they were the creme de la creme who went to AFMC. So in that sense, but people came from different backgrounds. And again, that was the place where you learned, it was literally national integration. We had people from, we also had people from Afghanistan, but then we had people from Sikkim, we had people from Bhutan, we had people from the Northeast, North, South. And it was a sort of a national integration there. During those days, I wanted to do pediatrics. So when I left college, I came back to Delhi to do my internship at the base hospital in Delhi in those days. And again, that was a real learning exercise because at the base hospital, again, we had some very good teachers and they would allow us. Of course, that's the time you start learning practically. You have to be a little independent. You have to take decisions. You have to start actually treating patients. It can be very scary and you need actually someone to guide you at that time and reassure you. You have to do surgery on your own. You have to handle emergencies. So those 6 months in base hospital and then 6 months in a primary healthcare center in Palam, which was of course a compulsory rural service at that time, really opens your eyes to the real world of medicine and the real problems that you face. And the only thing I wish is that in AFMC, they had exposed us more to rural medicine and primary health care. We did visit primary health centers, but we didn't spend time. I think it would be very useful for medical student to spend time in a rural area to understand what the rural needs are, because otherwise your teaching is more or less focused on, you know, what's coming to tertiary hospitals. And so you get one view of medicine, but you don't get necessarily the whole picture. And also you're not exposed to working in areas without any facilities or with limited facilities where you have to rely on your clinical skills. Today, I think with digital technologies, one hopes that we can overcome these deficiencies in the primary care where you don't have a specialist and that, you know, you don't have facilities, but using telehealth and using approaches like tele-mentoring that, again, there are AFMCites, my seniors from M-Batch, who have set up something called the ECHO platform, where they train, it's a platform for tele-mentoring of healthcare workers, whether they're doctors or nurses. And we've used it a lot during the COVID pandemic to reach people. For example, every Saturday we have a session with 600, 700 doctors in Nepal who join that session. And there are a few experts from any part of the world. Could be Nepali, could be Indian, could be anywhere. And they actually have a session where the doctors in Nepal who are seeing very difficult cases are discussing these cases with the experts and getting their opinion and improving their clinical practice. So I went to AIMS, did my MD there. And again, it was an excellent place, of course, to be doing pediatrics, very good faculty. You see all the different types of patients, because again, it's a referral center for the whole of North India. People come with all kinds of, and I'm happy to say that some of the diseases we saw at that time, like neonatal tetanus, one of the most horrible things that a baby can get and die of, are now eradicated in India because of the tetanus immunization program of pregnant women. Just a simple intervention like that can get rid of a horrible disease like tetanus. So we saw a lot of Kala Azar, again, a disease which was so common. We used to admit children with Kala Azar at least 2 or 3 a week. Today, there are very few cases of Kala Azar left, just in a few pockets of Bihar and Jharkhand. So many diseases now have come down, but there are other diseases, of course, which are increasing. We saw a lot of genetic cure, cancers, leukemias, very painful. So chronic disease in childhood it's a very difficult thing to handle, both for the family and for the physicians. And I got very attached to many of those families of children with cancer, whom we knew that, you know, the prognosis was poor, but we tried to take care of them as best as possible while they were, and some of them would improve. And again, now today, cancer prognosis is much, much better, particularly for childhood cancer. The advances today are huge, and you can really think about a cure for childhood cancer today. So on from there to Los Angeles, where I wanted to specialize in respiratory medicine or pulmonology. So I did a 2-year fellowship there, and that's where I learned research methods. So one thing I regret in MBBS and MD is not being taught research methods at all. And I think even till today, students are not taught research. And so there are very few who go in for research of high quality. So that's something that I've been trying to work with the leadership in the armed forces, medical services, to try to implement much more in AFMC. And things are changing. So I learned research methods. I learned pulmonary physiology. I came back. And when we came back to India, my husband, who was also an AFMCite, and I wanted to explore different things. He wanted to be in a private practice. I wanted to be in a teaching and academic environment. So we were looking around, and mainly in the South, because at that time, early 90s, there was private sector was, Apollo Hospital and so on had just opened in the South. That was the first time that there was a concept for private, large multi-speciality hospitals. Now it seems to be so common, but really in those days, and General Subramaniam in fact, was one of, I think, the early people who joined Apollo Hospital in Madras and was the chief of pathology there, and unfortunately passed away there. So we decided on Madras for a number of reasons at that time, and I worked for a little while with the private hospital, but then joined ICMR, which was for me at that time the best option for pursuing a career in academics and research, because I could not find a medical school in India, unlike in the US, where you have so many medical schools where you can do all the three. You can do teaching, research, and clinical medicine. That was an ideal combination for me. But in India, it didn't appear to be at all easy to find a place like that, even though I did try. You had to choose. You want to do clinical, you can do in private. You want to do research, then you have to be in a research institute. If you want to do academics and teaching, then you go to a medical school. A few medical schools, yes, you can combine, but very, very few. So that's how I ended up joining the TRC. At that time, it was called the Tuberculosis Research Center in Chetpet. And then it was renamed later as the National Institute for Research on Tuberculosis. And I had a very enjoyable stint there because it was research oriented. Everybody there was research oriented. There were different departments, so you could have interdepartmental, interdisciplinary kind of work. And after the first few years, I was given the opportunity to develop the new area of HIV and TB, because it was mainly a TB institute, but HIV was becoming a bigger and bigger problem in India. And so the Director General of the ICMR at that time told me that you need to develop this area, you decide what you want. So it was a test in leadership. I think at that time, maybe it was an opportunity given to me, which helped me later because I had to build something from scratch. There was nothing to do with HIV in that institute. So not only did I have to learn about HIV, and at that time it was very miserable because this was before the treatment became available. So essentially it was a death sentence and people would gradually get all sorts of complications. And there was a lot of social issues. There was stigma, there was discrimination, both in the healthcare sector and of course in the community. People were treated very badly, especially women were treated very badly by their families. They were thrown out. They had basically many children were orphaned. So it was quite a depressing environment to be working in, but at the same time, one could do a lot to help. And so we set up a number of clinical studies. We learned a lot about HIV and TB from those early days. I worked in a number of where all the patients to be admitted at that time. And I set up a team, I set up the lab to study all the special things we need. We had a good team of behavioral and social scientists who also joined the team. So it became an excellent team, and it grew and grew and grew. And then today the Institute does a lot of HIV-related research in addition to TB. And high quality work because of the, the Institute was set up by the British Medical Research Council in 1956, along with the government of Tamil Nadu and ICMR. So for the initial 5 years or 5 to 10 years, there were British scientists from the MRC who set up the studies and who trained the Indians who then took over the Institute. So very high standards of quality of research, etc., statistics. So that was very satisfying, because you knew that the research you were doing was good. But again, being a government institute, there are constraints and challenges, bureaucratic, hierarchical, all of those things exist, which make it, more challenging, because in research, you also require flexibility and freedom, and that's not always available to you. But during my, I spent from 92 to 2015 there, just with a short break when I left for 2 years. I also learned the importance of listening to community, listening to people, because, when you deal with patients in the clinic, you see one side of them. But in this center, because it was a research center and we had to follow up patients, we had to know everything about them. And we always visited them in their homes, especially if they didn't come, for a follow-up appointment or for treatment. We wouldn't just leave it. We would go to the home first the health visitor would go, then the social worker would go, and then third, the doctor would go. So I've been all over Chennai. I know all the slums of Chennai because our patients mostly lived in the slums. And then it humbles you because you go and you see how people are living, what their day-to-day circumstances are. And then here we are focused only on getting their TB treatment done. But they have, of course, their life to live, and also realize that alcoholism is a huge problem. And that really came in the way of people completing their treatment. But it gave a good understanding of the socio-economic determinants of health and why those are equally important, if not more important, than the medical interventions that we do. Also visited places, tribal areas like the Javadu Hills, where we had a program on TB and later on in nutrition, and saw again, the state of healthcare and facilities in the tribal areas, where people would have to walk for miles and miles to reach a primary healthcare center, where most of the time there was no doctor. There was just a compounder, somebody who was not even trained, who would take care of them. And that is why, people have to travel a long distance to get medical care. And also they prefer to go to private than government because it's more convenient for them, even if they have to pay. So going into those tribal areas and talking to people there, and actually, again, seeing the living conditions, again, brought home to me the differences in access to facilities, to healthcare between urban and rural areas, between the rich and the poor. And from then, I moved into the position of the DG of ICMR, which gave me a national level perspective with about 29 institutes of the ICMR in different parts of the country, focusing on different areas, all research, of course. And then also a number of rural health centers, we had set up research units, a number of medical colleges where my predecessor had set up these research units. So I was trying to strengthen those and expand those, and also visiting these, our own research institutes from the Andaman Islands to Dibrugarh in Assam, to Hyderabad, to Agra, to Bhopal, where we had set up a center after the Bhopal disaster, to places like Madurai, Mumbai, of course, Pune, where we have 3 institutes. And then I got to travel around the country as the head of the ICMR, of course, to all 4 corners of the country. But everywhere I went, I always tried to go, apart from going to the institution where I was invited to either give a talk or would always try to go into a field. And I would always tell my hosts, please, can we do a field visit in addition to whatever we're doing in your institute? So whether it was in Jodhpur, in Rajasthan, or whether it was in Srinagar, or whether it was in Dibrugarh, I always took one day off or one day extra to go into the field to see what the health conditions are and what the needs are, and talk to people, both from the medical profession, but also talk to the actual beneficiaries, the patients and their families and communities. And before I end, I will just give you 5-6 things which I think we need to look at going forward. In 2017, I was very happy in ICMR. I wanted to do a lot to strengthen medical research in the country. That's the time I started talking to the leadership of the Armed Forces Medical Services, also saying, why can't the armed forces do much more in terms of supporting medical research? You have all the facilities. You have almost a captive population of serving and retired people and their families. Excellent opportunities to do these longer term follow-up cohort studies, that are done in other countries to understand what happens to people during their life course, what diseases happen, what are the risk factors, how can you handle it. So I still feel that there's a missed opportunity there in the armed forces for not just integrating research into the excellent clinical care that is provided. But in 2017, in August, I got a call from the Director General of the WHO, the newly appointed Director General, Dr. Tedros, inviting me to come as his deputy. And this came out of the blue, actually. And it was through a WhatsApp call. So I was completely shocked and taken aback, because I had never in my life ever had an ambition to go to WHO or to serve in WHO. Somehow, it was never on my bucket list of things to do. And I wanted to build what I was doing in ICMR. I wanted to stay on in India and build that. And so I went to my minister at that time and said, I'm not interested in this. Don't you want me to continue serving here in India? And he said, no, this is a huge prestige for India. You can't say no at this point. We've never had this kind of opportunity, and you will never get this opportunity, and you have to go. So I was reluctant, very reluctant. I told Dr. Tedros also that I wasn't really very keen. And it was also, of course, both personal and professional, because professionally I felt I was just leaving what I'd set out to do, abandoning in a way. And personally, it would mean, being away from the family. But both the Indian government insisted, Dr. Tedros insisted. So I did join the WHO as a Deputy Director General in 2017, December. And it was a really steep learning curve, huge change from, looking at all over India to really having that global perspective and understanding what all the different arms of WHO are doing. We have 150 country offices. We have 6 regional offices. We have about 65 technical departments here in Geneva. And I, as a DDG of programs, had to have an oversight of all of that. Plus, we had a transformation agenda. Dr. Tedros wanted to change WHO to really be more future ready. And so we went through that for a year and a half. And then in 2019, March, the science division was created as a new division. And I was appointed as the chief scientist, which again, I was very happy. I was welcome, because rather than managerial responsibilities, I prefer to have more of, more technical responsibilities. And the science division gives me the opportunity to shape a new division again, but also to look ahead at what may be coming down in the future, to be WHO to be prepared, because if WHO is prepared, then the world can be prepared to meet the new challenges in technology, innovation, and science that are going to change. There's healthcare is going to change a lot in the coming years, and WHO needs to be able to give that guidance to countries. And apart from the pure scientific, we are also looking at the ethical, social, economic, and legal aspects of all of these new technologies. So it's a journey, it's continuing. And of course, the pandemic came, and I'm not going to say much about COVID. We're all sick and tired of hearing about it. But the pandemic has also tested the new science division to be able to respond with the latest data, communication, science communication, fighting the infodemic, fighting all the misinformation. And we can have more of that in the discussion. But just to close, I would like to maybe just bullets 5 or 6 things which I feel we need to focus on more during medical education, and also as we reimagine the healthcare system in India. The first is primary healthcare. We have to give more importance to primary healthcare. So far, we are focused only on tertiary healthcare, but the Ayushman Bharat program was actually imagined to set up primary healthcare, or to strengthen it rather. So I hope that will happen now, especially knowing and seeing what we have seen across the country with the devastation of the COVID, particularly the second wave. The second, as I mentioned, is research, and particularly for the armed forces, I think missed opportunities. But across India in medical schools, the research quantity and qualities can be really strengthened. I mean, you have probably 5 institutions you can count where the research output from medical college is excellent and world-class. The third is the community participation in health, which is lacking. And that's part of primary healthcare, actually. So good primary healthcare system engages the community as well, because without that, you can't improve health. You can treat disease, but our goal should be to improve health and well-being. You also need health literacy. You need people to believe in science and facts, not in rumors and misinformation. And people should be able to distinguish between credible evidence, credible information, and things which are quite clearly not plausible. So that comes only from a grounding in some kind of scientific thinking during school years. I think without that, it's very difficult to change people's minds. There's still a lot of superstitions that one hears about. And during COVID, it's multiplied 1,000 times, but it's there even otherwise. So scientific literacy and health literacy of people has to start from school age, and we need to focus on that. And then I think finally, as I said, we focus a lot on healthcare delivery. That's what the health department and doctors are for, of course, but we don't think about the determinants of health and the risk factors, which in the first place make us unhealthy. And these are things like, of course, the quality of water, the quality of air. Air pollution is a huge risk factor for health. Balanced diets, undernutrition and overnutrition are the biggest risk factors today globally, and definitely in India. Both under and overnutrition exists. So while obesity is growing, at the same time, children with stunting and undernutrition are also increasing. By the latest National Family Health Survey, the data is not very good. Anemia is a big problem, particularly in women. So those are all cannot be corrected by treatment. You have to address the root causes. So you have to go upstream, and all sectors will need to be involved in this. Air pollution is not something that the health people can solve. Road safety is not something the health people can solve. Mental health, housing, water, sanitation. I remember going to these villages in Bihar where the Kala Azar used to be endemic. And the main reason for Kala Azar not getting eradicated was the fact that these people, very, very poor communities, it affects really the poorest of the poor. They live in these mud houses, literally like little huts at the outskirts of the village, and they get these sandflies live on the mud walls of the houses. And the sandflies are the ones that transmit Kala Azar. The moment you change the housing and you build paka houses, the disease disappears. So the intervention is not to treat more of Kala Azar, but the intervention really is to make sure that people are not living in those mud huts anymore. So it's just an example of, again, you travel in the field, you see these things, and then you realize that health is something that goes way beyond doctors and what they are able to do. And it needs a general dialogue in society, and as well as, of course, investment by the government into these factors. But that's the future. And the link between environment and health is getting more and more clear, whether it's climate change induced. We're seeing the terrible floods all over the world, the landslides in Maharashtra, so whether it's climate change, global warming, or air pollution, I think the solution has to really come from massive changes in the way we're living today. Thank you very much, Himanshu Varthaman, and I will turn it back to you now.
Thank you very much, ma'am. Thank you very much for giving us a deep insight into the journey of your life, starting from the school days in Delhi, going to your hometown, Kumbakonam, and the journey up to Geneva. And yes, I think we'll start the question and answer session now. Ladies and gentlemen, we just have 10 minutes only today for the question and answer session because of the other prior commitments of Dr. Soumya. Ma'am, I will first start off with asking you a question. Now, you have been in WHO now for about 2 years. How different is the work culture there, and how different is it working with people from other countries compared to your experience here in India?
Yeah, I mean, I think that's one of the most enjoyable experiences for me is working. In fact, I often play a game myself when I'm sitting in a room full of people. You will hear at least 10 different accents. And one of the things that I like to do is to guess which part of the country that person is from, and then later on I confirm it with them. And particularly from Africa, every country has their own unique accent. So it's really very nice. I mean, you have people who are so committed, who are technically so knowledgeable, that I really admire a lot of my colleagues I work with. That's why I said it was a very steep learning curve when I came here. I learned about a lot of things. And I think what I've realized is that WHO has huge impact, particularly in the lower and middle income countries. People really want WHO guidelines on many things which they can use in their countries. And so it's particularly with the new areas that I'm working on now, with digital health, with research, with innovation, it's very exciting. So the work culture, I would say, it's also a bureaucratic organization. I should say that, we are 8,000 people. It's a huge, people call it, huge bureaucracy. The UN is a bureaucracy. But again, I think there's a lot of opportunity and freedom to do things. You have to, of course, follow all the rules. Sometimes it takes a long time to do things which you think you can do much faster. But the impact is also very, very big. So it's a different type of environment, I guess, because it's so global, multicultural, multinational. So you also have to, we are all the time reminded that we have to be inclusive, we have to respect diversity, etc. I think it's a good message for us in India as well, because we have as much diversity within India that we have here in an international organization.
Well, ma'am, after your, passing out of AFMC, did you try to join the armed forces? Any regrets in joining? I mean, not joining?
No, I don't think I regret not joining. I was very clear with I wanted to specialize in pediatrics and do research. That was the main reason for not joining the armed forces. I knew that it could be a very good life, that it could be a good opportunity as well. But at that time, I knew that armed forces was not the place where I could either get specialized early or focus on research in my career. And as I said, from childhood, I had been committed to doing research. So that's the reason why I didn't join. And I suppose I don't regret it. No.
Wonderful, wonderful. One more question from my side before I allow the others. What is the biggest factor that has helped you to be successful in your career?
I don't know if there's any one factor, but I think one of the things I learned again probably from my father was the ability to listen to people and the ability to work as a team and to take everybody along. I think for leadership, you need that. So whether it was my colleagues, I learned so many things from the nurses I worked with and the social scientists I worked with, and from the patients and the communities. And even today, I feel that, you can't know everything. It's impossible for any leader to know about everything. You have to listen, and you have to constantly be aware
Right.
What's happening around you, and you have to be willing to adapt. So I would say that was probably the one factor.
Okay, ma'am. Thank you. Now, Brigadier Shanmuganandam has raised his hand. He wants to ask you a question. Brigadier Shanmuganandam, sir, your question, followed by Brigadier Subramaniam. Go ahead, Brigadier Shanmuganandam.
Good morning, ma'am. I'm from U batch. Ma'am, I just wanted your views on this digital health. Since COVID has come, and before that they had legalized this digital health, it has proved very, very good, because we were, as retired army officers, were involved in that e-Sanjeevani OPD, and only few states took it up, like Himachal Pradesh, Tamil Nadu, and Andhra and Karnataka. The penetrance was little not too good. I thought this is a very good force multiplier for giving even expert advice. Like, I'm a physician, so that can percolate to all the places in rural India. So that's, I just wanted your view. If we can expand it both in the world level and in the Indian level, lot many patients can be benefited, ma'am.
Yeah, you're very right. And I think it's more of a comment. It's not a question to me, but I totally agree with you that we have to look at the opportunities that this offers, and particularly now with the e-Sanjeevani platform, as you rightly said, it gives opportunity to retired doctors to provide their their services, but also to patients in remote areas. But again, a few things we have to keep in mind. One is, who are the people who are unable to connect to this? Is it again a service that can be provided to the same people who would have access? Or is it reaching those who otherwise don't have access? So that is something to be studied, How many people from the remote areas are able to access? And if not, then what is it that we can do to improve the connectivity and so on? Again, community health workers and the ASHA workers can play a role as an intermediary. If they all are given tablets, then they can be the ones who connect the patient with a specialist. So I think eSanjeevani needs to be studied. It needs to be expanded and strengthened. There are many other applications of digital technologies, for keeping in touch with patients through either SMS or through other means. People who have chronic diseases like hypertension and diabetes, or even TB, where you have to take treatment for a long time. This is a good way of keeping in touch without making people travel up and down. And the third, I think, is for training. Like I said, this ECHO platform and models like that can be used for skilling, constantly upskilling people, particularly those who are stuck in remote areas. Maybe that's good for the armed forces as well, because when you go to these remote outposts, where a young medical doctor graduate is stuck all alone, they have not much of medical, things to do when in peacetime. So they are a bit bored as well. And at the same time, they don't have any peers, anyone to discuss with. So perhaps using these digital platforms to connect up, especially with the young officers who are serving in field areas, could be also good to keep them in the, the loop. And,
Yes. Thank you, ma'am.
Thank you, ma'am. I think we'll have time only for just one more question. Brigadier Subramaniam, sir, you have raised your hand long back. Kindly unmute yourself and ask the question, sir.
Good morning, ma'am. My question is, are we doing enough on preventive health? Because I think if we do more on preventive health, number of cases to deal with will be far less than what we are having today. So how do we improve preventive health in our country?
That's a very good question. And I mentioned it towards the end about why we need to focus more on preventive. And you're right. I don't think we do. Neither our medical training really focuses on that, and neither do our systems later on focus on that. And how do we focus on it? I think a lot of it is behavior change. When you talk about the top risk factors, they are actually, as I mentioned, under lack of a balanced diet. That's the number one. Then you have the high blood pressure and high blood sugar, again, partly linked genetics, but partly to the diet and physical activity. So physical inactivity is supposed to be one of the biggest growing global risk factors. More and more people are becoming physically inactive, both young and older people. Then tobacco. So tobacco is still, a growing problem. Not growing, it's reducing in terms of percentage, but it's still a huge problem with over 1 billion people globally who are addicted to tobacco. And then you have things like the water, the clean water, sanitation, and air pollution. These are the other major top, if you look at the top 10 risk factors for health. Road traffic injuries also actually features in that. So once you know what they are, then you have to think of what interventions. Some are on the policy side, which the government has to do. And some are on the individual side, the behavioral side. Some are related to socioeconomic factors. I mean, having a balanced diet means that you need enough of an income also, because you can't afford fruits and vegetables if you are, very, very poor in India. You end up having a high cereal, high carbohydrate diet, because that's what you get from the PDS. So there are some structural defects also, which need to be, again, looked at through policy interventions. But it's really the area that we have to focus on. So thank you for bringing attention to this.
Thank you.
Thank you very much, ma'am. It's been, yes, sir.
I see Dr. Raghavan wants to say something.
Yes, give Dr. Raghavan.
Yeah.
Hi. There's no need to compliment you because you're superb as always. You know, the research in armed forces, I think it's a non-starter because by the time a guy gets posted to AFMC from Timbuktu, first he has to get familiarized into teaching, which is the primary job of undergraduates. So going into research and before he gets his, foot in, he's posted out. Unless, you're in the right position to, come on to government of India, with the armed forces officers, the armed forces, the brass is not going to start something for the research because it's not happened. So until you get a government of India to kind of initiate a center for research in AFMC and have people posted there for minimum for some 10 years or something, or some kind of a thing, I don't think the research is going to be a non-starter in AFMC. That's my suggestion. Thanks.
Very
Well,
good.
Well, Dr. Soumya, thank you very much for having agreed to be a guest in our this morning's Connect series. Thank you very much for having spent the time with us in spite of your busy schedule. So, like I said, we had an hour's time for you. Thanks for your request. Now it's over to Air Marshal Varthaman, sir. Sir, it's over to you.
Ma'am, thank you very much for spending time with us. I only wish we had a little more time. And in fact, we were looking for another 30 minutes of Q&A. But we fully understand your commitments and your responsibilities globally. All our very best wishes to you, ma'am. You made us very proud. We wish you a great success in the years to come. And may you make our nation proud. God bless you and Jai Hind, ma'am.
Thank you very much and Jai Hind. Thank you all.
Thank you. Thank you, ma'am. Mm-hmm.